Welcome back, family, to Family Matters with Dr. Q, our podcast where we talk everything baby making. And today, again, you are with your favorite gynecologist and fertility specialist, Dr. Q. Road. That's your township girl right here. And today, we're going to be talking everything baby making. And specifically today, we are going to talk about preparing for a pregnancy. Some people don't even know there's such a thing, that you need to prepare for a pregnancy. So what are the ways that you can get your body ready for this big adventure? What are the ways that you can prepare yourself to be that mom, to be that carrier, to be that nurturer that you are aiming to be? So I always liken pregnancy like planting a seed in a field. So if you want to have a field full of spinach, if you want to have a field full of peaches, peach trees everywhere, you can't just throw your seed onto a soil and walk away. Before you even plant that seed, you've planned in your mind that you want to have this forest of whatever you want to have. But now you need to prepare that soil. You choose a field, then you go on and say, look, the field is rocky or the field is full of weed, and you tilt the soil before you plant that seed. You prepare, you put manure, you put fertilizer, and you tilt the soil. So that is exactly how pregnancy works out. You don't just jump in and say, hey, wow. Sometimes I know mistakes, oopsies do happen, which is why it's very important for women to make sure that at any given time, they are living a healthy life, they are taking good care of themselves, even when they are on contraception. Because, hey, you never know. No contraception is 100%. Let's just remember that. So you don't want to be a 0.1%. And when you do, please, these are the ways that we can help you to make sure that you are ready for a healthy and happy pregnancy. Let's get right into it. So the biggest question is, when do I start preparing for a pregnancy? The best way to have it is stay ready. If you know that you'd like to be a mom someday in the future, just keep yourself ready. In terms of your health, that is. Because some of the health issues that you may need or you may be facing during the time of pregnancies could result from your lifestyle that you've had over the past few years. So if under generally you keep a healthy lifestyle, and I'll be discussing what a healthy lifestyle is, then you have less chances of regrets going forward. So for most people, they decide to start preparing for a pregnancy, and medically, we recommend nothing less than 3 months before you fall pregnant. So this is because there are some supplements that you need to take that need to absorb in your body and start working before that seed is planted. So that's the manure. And again, some of the issues that you may be facing before pregnancy or when you're trying to fall pregnant are conditions that will take time for you to resolve. Example, an issue of obesity. It's not something that you can work out just 3 months before pregnancy. It may take a year. It may take 2 years to get to an ideal weight or a healthy weight that will cause you to have a healthier pregnancy. So, what is it that you need to prepare for? So some couples, they do come in even a year before they start with the journey of pregnancy. And this is quite great. And I'm happy to see people do this, because sometimes you find that we've got issues that need time. Issues like finding that there is a low egg reserve, or there's issues with sperm and all of that. And some of it's things like diabetes, finding that you've got issues that you need to take time to control before we drop that seed. So yes, so anything between 3 months to a year, please do start with your preparation for pregnancy. So how do you prepare? Number one, you need to supplement yourself. So this is now taking in the manure, the fertilizer that will make your body ready, all in your blood system, ready to bring that life to earth. So one of the supplements that are recommended that women who are trying to fall pregnant must take is folic acid. And this actually helps with prevention of what we call neural tube defects, where babies are born with abnormalities in the spine that could affect their quality of life. So folic acid, a lot of women are aware of it and they already start taking it in their journey of preparing for pregnancy. And we do recommend, especially for patients that are suffering from polycystic ovarian syndrome, PCOS, to do take supplements that contain myoinositol and D-chironositol. So these are supplements that actually work on the ovaries and making sure that you get nice, good quality eggs to making that good quality baby, because we do want to end up with a healthy, bouncy baby. So that actually helps to supplement the quality of the eggs that you produce. Ain't we happy about that? So what are the other lifestyle changes that you need to have before you consider falling pregnant? And I'm sure you know about this, and we mention it for most conditions. People need to stop smoking. Yes, you can start by reducing months or years before you consider going through a pregnancy. But by the time you fall pregnant or you are planning or preparing for a pregnancy, we medically would recommend that you completely stop smoking altogether. This is not because we are trying to reduce the fun out of you and want to make you a zombie or we want to keep you stressed. Listen, let's find other ways of de-stressing except smoking, because this has adverse effects on the little one. This is like now saying you've planted your seed and then there is weed growing in the field that's affecting the growth of your plant, or the soil has a bit of oil in it that affects the growth of your seed. So that is what smoking actually does, because it goes in, the smoke, the nicotine, it goes in and destroys the blood vessels, the piping system that brings water to your field, or the piping system, which is now the blood supply, the blood vessels that supply blood to your little one. And remember, the blood supply brings nutrients, it brings oxygen, it brings about growth. But now with smoking, that's where now people who smoke, most times, this is not all the time, and it also depends on the number of cigarettes a day that you take and what type of smoking exactly. What are you using? Are we talking cannabis? Are we talking cigarettes? Are we talking vaping? All of that. But all these things do, unfortunately, have a negative effect on the growth of the baby, as it results in what we call intrauterine growth restriction, which is having small babies. The babies don't reach their potential size. And depending on how severe it is, these babies, if not caught early or detected early, can end up unfortunately dying inside the mother's womb. And that is a very traumatic experience that we don't wish for even your greatest enemy. So please, if you can, start reducing with smoking, getting other habits to supplement this habit, and then eventually stopping altogether, then you know you've provided a good environment for that little one to grow. The next lifestyle issue is drinking. So drinking also does have negative impacts on the little one, especially if there's high drinking in the first trimester. Remember, the first trimester is very critical. This is where the baby is being formed, where the organs are being formed, the tissues are being formed, the facial structure is being formed. Your baby's beauty is being determined in the first trimester, the first 8 weeks of life. And this is where most women don't even know that they are pregnant. pregnant, where they are surprised, oopsie, it just happened. That is why I say keeping a healthy lifestyle throughout, if you will want to be a mother one day, will actually save you, because if you have an oopsie and you have a good lifestyle anyway, there's not much to worry about. But when alcohol is a problem and there's high levels of alcohol in the bloodstream, then it affects the baby's development, and there is what is called fetal alcohol syndrome, which would then affect the baby's facial features. I won't mention what is it that we look for, because I don't want you going around diagnosing people's kids, but there is fetal alcohol syndrome, and it can even affect the brain function of the baby. Kids can be retarded by whatever substance that the mother is using during pregnancy or even just before. Again, this brings me to the next point when I'm speaking about substances, and this is chronic conditions. Chronic conditions like diabetes, hypertension, asthma, even epilepsy, and the works. There are many conditions that you need to check up for before pregnancy and make sure that all of them are controlled. If you are a diabetic and you are on treatment, but the sugar is not controlled, this can, at the time of pregnancy, affect the baby again in the most critical stages, which is the first trimester. Then the baby's heart can be affected, the baby's spine can be affected, babies can have what we would simply call a hole in the heart, or the baby can have other issues with the brain development. Every part of the body is actually affected in the first trimester because the baby is being formed. So you need to get good control of the diabetes and epilepsy as well, because some of the drugs that are used to treat depression, that are used to treat epilepsy, that are used to treat acne are actually what we call teratogenic, meaning they can cause abnormal structures in the baby. So you need to go and check up with your doctor. Is this treatment that I'm taking correct and safe for pregnancy? So at least 3 months before pregnancy, you need to be off that Roaccutane because it causes teratogenic effects on the little one. You need to make sure that your sugar is controlled 3 months and longer before you even fall pregnant, because we don't want you to be in a condition where you are now pregnant and we tell you the baby's brain is affected, or from Sona, this is what we are picking up, and you end up having to be the one that allows the termination of that pregnancy, since it will not be compatible with life. So you don't want to find yourself in that situation. That is why preparing for a pregnancy is actually vital. Again, what is also important when you are preparing for pregnancy, and this, the women actually mix up. They say, I will lose weight after the pregnancy, after the delivery, and then I'll start working on my body. Hey, ladies, it's the other way around, because you feel that you're going to gain weight anyway during the pregnancy. Then you're like, oh, let me let it go. I'll sort myself out after the pregnancy. We actually need you to start it before the pregnancy, because obesity has many adverse effects on the pregnancy, and it puts the mother's life at risk and the baby's life at risk, especially again for women who would like to have a natural vaginal delivery, and you find that they're obese, and that obesity can affect the baby, and that baby can also come out obese for a baby. Like you get what we call a big baby. For South African women, it's babies that are more than 4 kg. Then that baby is at risk coming out of the vaginal canal of being stuck, what we call shoulder distortion, and it can also put the baby's life at risk. So what you are during the pregnancy actually imprints onto your little one. These are the genetics that you are transferring onto your little one. If you are obese during the pregnancy, then the little one unfortunately is at risk of diabetes as well when they are born and they grow up. They may not be born with diabetes, but they're at high risk of developing it later on in life. So those are the risks that you actually put on yourself which is hypertension in pregnancy, diabetes in pregnancy, which are conditions that are very critical and can at times lead to maternal deaths if not caught or detected within the nick of time for treatment to be given properly. So these are the things we would like to avoid if we can. And that is now making sure that you have a good body mass index before the pregnancy by losing weight, putting a little bit of walking, putting a little bit of jogging, a little bit of exercise, join the gym, join the club, go on for women's clubs in exercising, etc., etc. So find ways, get a good dietitian who will give you a specified diet as to what is specific for you to eat and avoid for you to have that good weight before the pregnancy. So prepare for your pregnancy by working on your weight loss. What is also very important in preparing for a pregnancy that a lot of people omit or leave out for later is actually going for a checkup before you fall pregnant. You don't want to be pregnant and then suddenly find out you've got this big fibroid that's in your womb and it's putting you at risk of a miscarriage or preterm labor, etc., etc. You would like to get certain things sorted out before the pregnancy so you have a smooth sail. We want every pregnancy to be healthy and happy. So it's important to go for a checkup before your pregnancy. Sometimes women are actually surprised to find out that they were planning to fall pregnant in 2 years, only to find that their egg reserves are so low that we don't even know if they'll be having eggs by the time they plan to fall pregnant 2 years later or more. So it's important to actually get a checkup, get a fertility check, out of interest, knowing that one day, sooner or later, you'll be planning to walk down that motherhood experience. So it's important to get a checkup, make sure a thorough history is taken of all the medical conditions or treatment you're on and your lifestyle. Make sure that your womb is actually checked. So this is where an ultrasound is very important. We check your womb if there's any problems that you can encounter during the time of pregnancy. Make sure that there's no fibroids, and we check out your ovaries as well to make sure that you've got a healthy count and you are not troubled by anything going forward. So this is one of the ways that you can prepare for a healthy pregnancy. If there's a way that you can go as a couple, because sometimes you are so healthy, you are all checked up, you've ticked all your boxes, and then you don't know about your partner. I know males are very reluctant in walking this journey and getting checkups, but gentlemen, we need just one thing from you. A lot of people are surprised at the time that they've been trying to fall pregnant. Maybe 3 years go by and you guys are trying to fall pregnant, only to find that there is unfortunately a male factor where you are trying to make a baby, but there's no sperm at all. Or there's very little sperm, or the sperm can't swim, or the sperm is not the right shape. So, gentlemen, you are also part of this journey. Get yourself a checkup. Make sure that the boys are good in numbers, they can swim, and they look good as well. They'll be able to fertilize that egg. And the sooner you find out before you are at the time of trying to fall pregnant, the better, because then something can be done and we can look at the different options that you can be assisted and delay or fast track or eliminate that point of huge disappointment. It's very important to note that 30% of men actually do have infertility issues. They suffer from infertility due to many conditions. So you could be with a partner that is actually suffering from infertility, or you could be that partner that is part of the 30%. And 50% of the time, you find that it's both a male and female issue. So wouldn't it be better to find out 2 years before you're ready to have a baby that there is a problem that you need to work on? I think that's actually a good one. So if you are trying to conceive, you are set with your partner, but you are not yet ready to go through the journey, consider getting a pre-pregnancy checkup where we can even test the male sperm just to make sure that we will not run dry or we will not be faced with surprises that will then delay, because some people come at the 11th hour when they are already 37, when they are already at advanced age, and now they want a baby now, only to find that, hey, there are certain things we need to take care of. We need to remove the fibroids. We need to go on sperm supplements, etc., etc. So if you come in as it takes two to tango, we can be able to assess you both and tell you that, yes, you are healthy. We give you a clean bill of health and say, go ahead and have that fun and have that little one. Again, on your checkup, you may consider a few things. Most times you find that women are anemic and they don't even know it. And this can negatively affect the pregnancy when the iron count is low, or some people will call it a low blood count. That's how they understand it. But this is called anemia when the iron levels are low in the body. So it's important to know where you fall in. So having a full blood count will actually assist you so that you can start taking your iron supplements a bit earlier so that you're healthy along your way of pregnancy. And again, what I recommend for most women, which I want this to not be a surprise, if every woman who wants to be a mother one day can just pop in and do what we call anti-Mullerian hormone. Only 1% of the population actually suffers from primary ovarian insufficiency, where they run out of eggs beforehand, before the age of 40. But you don't want to be even part of that 1%, because that is 100% too much if it's yourself. So just have your anti-Mullerian hormone checked out, or even in a sauna, a gynae can actually check for you that, yes, you have ample eggs in the ovaries. Then that's good enough if the follicles are showing. Or you can do a blood test called anti-Mullerian hormone to check how long can you still go if you want to delay that process of pregnancy, because you don't want to get a surprise. Some women even come into us wanting to be egg donors, and we find that when we do their anti-Mullerian hormone, AMH, it is so low that they need to be actually making their own babies, as in right now, because then give it 5 years down the line, that woman will not be having, unfortunately, a good egg reserve, and will probably be needing an egg donor themselves to actually go ahead with their baby making journey. So very important, consider having a full blood count and an anti-Mullerian hormone. And last but not least, when you're ready to have that baby, to hit that road, Jack, and go on your baby making journey, do consider stopping contraception. There are women who come in and I'm assisting them with falling pregnant, and only to find that, yes, on the side, they're still taking an oral contraception for their skin, they say. But hey, it does stop you from falling pregnant. It still works as an oral contraception, even if you're taking it for pelvic pain, even if you're taking it for skin. So even a condom, guys, is a form of contraception. So at least 3 months before, if you are on a hormonal contraception, do consider stopping that at a time that you know if a pregnancy happens in a month or two, you will actually be fine with that. But give it at least 3 months for all these hormonal injections or intrauterine device or a tablet that you're taking or a patch, whatever form of contraception that uses hormone, give it 3 months. And then you can be sure that at least you've given it enough time to wear out of your system. So that do 3 months before you actually want a baby now. So that's it from me. There are many other tips we can share, but do follow us on our YouTube page, follow us on Instagram, follow us on Facebook, so that you don't miss out on the next informative session helping you go through your baby making journey. And that's it from me, Dr. Q. Till next time.